Most people who have diabetes don't have any symptoms at all, not even the classical thirsty all the time and weight loss and going to the toilet all the time. So it's very important, even if you don't have any symptoms of diabetes, that you have a test done. So what are the tests for diabetes? Actually, the test for diabetes is very easy. Traditionally, we always remember the finger prick test, where you prick your finger and squeeze a little bit of blood out, and we test for the amount of sugar in the blood at that moment. But that only gives us the amount of sugar in the blood at that very minute that you take the test. There's a much better test called the Hba1c test, which measures the amount of sugar that's been in your blood on average over the last 3 months. So if you take that blood test today, it gives you an average over the last 3 months of what your blood sugar has been like. And this is a much more useful test than just a single finger prick test. The Hba1c test is done through a venous blood sample or a capillary blood sample. So that means that you can either take the blood from your arm, like you do when you go to the doctor or the nurse, or you can purchase a kit online where you prick your finger and squeeze the blood into a little tiny tube, and we collect all those little drops of blood and measure, rather than measuring just the glucose, we measure the Hba1c, which gives us that idea of what's been happening over the last 3 months, and will give us a very good idea as to whether you actually have type 2 diabetes or whether you may be prone to getting diabetes by having the pre-diabetes. So why is it important to do a test? We know that having too much sugar in the blood that your cells can't cope with can be very damaging to your vital organs. It can affect your eyes, your kidneys, your heart, your brain, and it can affect the very end nerves and blood vessels of your fingers and toes. So classically, people with long-term high sugar levels can suffer with things like blindness or reduction in their kidney function. They're more likely to have heart attacks and strokes, and they can also get that nasty nerve pain and tingling or loss of sensation in the ends of the fingers and toes. Now, not all people with diabetes will get this. It's only if you have high sugar levels that haven't been managed. So what can we do about diabetes? The first thing of all is to have a look at how much sugar and carbohydrates that you're eating. We always think about chocolate and sweets, but actually bread and carbohydrates convert into sugar, so it's important to have a look at that as well. If you're carrying any extra weight, particularly around your tummy, then weight loss is a marvellous way of reducing diabetes or reducing pre-diabetes and stopping the risk of having diabetes in the future. If that's not enough, then we can use tablets, and there's a variety of tablets that we can use to help reduce the Hba1c or reduce the sugar level in your blood. And then some people need injections, and some people need injections of insulin. The most important thing about diabetes is to make sure that you get it tested early.